What causes MS? Well, we really would like to know, but the short answer is we're not sure. What we do know is that MS is the result of an abnormal immune system response that damages the myelin sheaths that coat the wires or axons of nerves, and that the axons and nerve cells are also damaged. But we aren't sure what specifically provokes that response. One theory is that at some point a person with MS was exposed to a virus or some other microbial agent that puts certain cells in the immune system into overdrive. Many possible agents, including environmental toxins as well as bacteria and viruses, have been investigated, but none has so far proved to be the MS trigger. We think that people who develop MS may have a genetic predisposition that allows exposure to certain infections or environmental toxins to trigger an abnormal immune response. We also know that having a parent or a sibling with MS significantly increases an individual's risks, although fortunately that risk still remains quite low. There's also increasingly more evidence that smoking raises a person's risk of developing MS, and that's yet one more reason for people not to smoke. We also know that people living farther away from the equator are more at risk for MS than those who live closer to the equator. This might relate to sunlight exposure and levels of vitamin D, but that's not absolutely certain yet. The National MS Society is funding studies on the role that vitamin D may have in MS susceptibility and for its potential for reducing MS disease activity. For more information, see the question and answer on vitamin D and MS in this series.